Diagnosis, differential diagnosis of idiopathic Parkinson disease, atypical Parkinsonism, that means Parkinson plus, that is multisystem atrophy, progressive supranuclear palsy, there is corticobasal degeneration and dementia of the Lewy body. A secondary Parkinson is drug induced like antipsychotic, there may be post traumatic like boxer, like Muhammad Ali. Metabolic is Wilson disease, toxic is carbon monoxide poisoning, infectious is Brand's disease, and vascular is lacunar stroke and mimics of Parkinsonism, like normal pressure of hydrocephalus, essential tremor, and functional tremor. Parkinson disease is a clinical diagnosis that relies on careful history and neurological examination, and the Parkinson disorder by the presence or absence of the following diagnostic criteria, like exclusion criteria, like specific findings of alternate pathology of the Parkinsonism. If there is vertical supranuclear palsy from progressive supranuclear palsy, there may be red flags, potential signs of another cause of Parkinsonism like rapid progression, symmetric symptoms, and hyperreflexia, and some supportive criteria, clinical feature that increase the probability of the Parkinson disease, as the etiology of the Parkinson disease, like asymmetric symptom like olfactory dysfunction. So, beyond history and physical examination, the most important supportive feature for establishing Parkinson disease as the cause of Parkinsonism is a dramatic response to dopaminergic therapy. Most patients with Parkinson disease will show immediate improvement with dopaminergic drugs. Other forms of Parkinson respond poorly to them, like Parkinson plus disease, multisystem atrophy happens, develop in multiple system like autonomic system, early autonomic failure, there is severe orthosis, urinary incontinence, early postural instability like falls, and there may be cerebellar problem, there is gait ataxia. So autonomic failure, postural instability, and cerebellar problem like gait ataxia, progressive supranuclear palsy, there is vertical gauge palsy, and there is postural instability, akinesia, and progressive aphasia. So progressive supranuclear palsy is vertical gauge palsy, dementia of the Lewy body is hallucinations like visual hallucination, and there is early dementia, just opposite of Alzheimer disease, where there is a and there is cognitive fluctuation and REM sleep behavior disorder, and corticobasal degeneration, there is alien limb phenomenon, there is myoclonus dystonia, and cortical sensory loss. In cortical basal degeneration, there is cortical sensory loss, myoclonus